Okay, the very last one, finally for you guys. I've put this all together as one for the urinary system and reproductive systems because they do share a lot of physiology and anatomy. So we can't get to the finish line here. For the females, the urinary and the reproductive systems are distinct. They are separated. For the males, they share some components, obviously. The kidneys, just a little going to remove the waste. The nephrons are the functional unit, and they do filter the blood to form urine. And then the urine travels down the ureters to the urinary bladder, and then out the urethra. So there is some different, for the males, the urethra is one versus the females where the urethra is separated from the vaginal area. So those two sections are different versus in the male where the semen and the urethra and the urine goes through the penile area. Okay, so for the female, I'm not going to go too much into this because, again, this is anatomy and physiology. But you can see what all these sections do. The main thing to realize is that microorganisms, the vaginal area is a portal of entry. Microorganisms can get into the reproductive tract through the vaginal area and move up. In order to get into the kidneys, they have to go through the urethra, which is a different thing, and we'll talk about that. But yeah. So if we look at the reproductive structures of the female, you can get up in here and get an infection in here. But when you look at the urethra, it's coming here, and that is your urinary bladder. So you've got two different exit points. So you have two different entry points for that. One of the problems we'll talk about with the female is that frequently get urinary tract infections due to E. coli, because if you wipe the wrong way, you can get that E. coli right here, which will bring that E. coli. They are motile. It'll bring that E. coli up into the urethra of the female. For the male, microorganisms can enter through the urethra or the skin of the penis. They really don't get UTIs too much unless catheterization, because it's a long way from here to here. So there's, unless you're in a diaper or something like that, you usually don't get E. coli up, from the anus into the urethral opening. So, it's a little different track here. Urethra itself has several organisms in there: Lactobacillus, Staphylococcus. Basically, it's at the opening. For the males, the region above the prostate should be sterile. For the female, the vaginal area is colonized by various microorganisms depending on hormone levels, but we want to see those levels because of introduction from the male with the sexual intercourse. So the microorganisms that infect the urethra can move up and infect the kidneys. Opportunistic and sexually transmitted microbes can infect the reproductive systems. So let's look at first the bacterial diseases of the urinary system. And the number one is the urinary tract infection. Okay, number one. Signs and symptoms: painful urination. The urine can be cloudy. It can have a pretty foul odor. Urgency, frequency in urination. The enteric bacteria are the most common cause, and it is E. coli that is the number one cause of those cases. E. coli does have virulence factors. It does have flagella. It does have attachments of embrace. So if it can get up there, it can attach and it can multiply. Usually it's caused by, again, self-inoculation of the urethra with fecal bacteria. And it is more common in the females because we have a shorter urethra. And it is closer to the anus. And it's just, a physical fact. So we're going to see UTIs more commonly in the females. Diagnosis is based on symptoms, but the urinalysis is presented to us, and we can very easily see the bacteria in the urine when we spin it down and look at it. Some of these cases will resolve without treatment, and some require treatment with antimicrobial drugs. But the UTI is usually generally fairly easy to take care of. We can prevent this by being, especially the females, by being more careful how they wipe, after having gone to the bathroom, and trying not to get that fecal material close to this urethral opening. Leptospirosis, can I speak today? Humans and typicals usually come in contact with this from infected animal urine, often the rodents, dogs, and so on. Just mentioning that the symptoms range from mild flu-like symptoms. It can be life-threatening. Just FYI, giving you a little more information on that. Glomerulonephritis. This gets to be pretty interesting. This is an inflammation of the glomeruli in the kidneys. And the antigens of this is group A strep, our lovely little group A strep. The antigens of some group A strep strains are not removed from the body when they are bound. And this antigen-antibody complex can get deposited in the glomeruli of the kidneys. And it will produce an inflammation. And it produces hypertension, high blood pressure, and a low urine output. Young patients usually recover, but irreversible kidney damage can occur in adults. So it's nothing to play around with. So, if you get a strep throat and stuff like that, you have to always be careful that you may not, you can get some cardiac problems. You can get kidney problems. So anytime you're working with group A strep, you kind of have to worry about this kind of stuff. Now, we're going to look at first the non-venereal diseases. That's really the key. Non-venereal diseases of the reproductive system. These are usually not transmitted sexually. Okay. Can't spell the word non, can I? I might need to redo this. Sorry, guys. Let's try and spell this right. Right? The non-venereal diseases, basically, we're looking at toxic shock syndrome, what's called a bacterial vaginosis, and candidiasis, a yeast infection. These are not generally sexually transmitted. First of all, staph toxic shock syndrome. This is rare. It's life-threatening. It's caused by the toxins of Staph aureus. And you can see high fever, low pressure, multi-drug organ failure, and it requires emergency treatment. It is produced by the toxic shocks. Yeah, the superantigens of the staph. We talked about this. It can cause toxic shock. They overstimulate the immune system, which causes a widespread inflammation and leakage out the capillaries. It used to be linked to these high absorbency tampons or leaving them in too long. And so, I can remember they just stopped using them because they had so many cases of it and they were much careful. Only about half of all these cases are non-menstrual. So non-menstrual triggers can be in any gender or any age group. and is often triggered by skin wounds, burns, surgical instruments, blah, 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 incisions, nasal packing, and virus. So just think that, toxic shock syndrome historically very associated with menstrual products, not necessarily. I just wanted to add that in there for you guys. Bacterial vaginosis, this is a non-sexually transmitted disease, depending on what it is. Typical signs are a vaginal discharge with a fishy odor, usually caused by Gardnerella. When the lactobacillus levels are low, Gardnerella can form a biofilm. It is associated with having multiple sex partners and frequent vaginal douching. And diagnosed by this discharge, it is usually treated with oral medication. Other conditions can resemble this, such as a yeast infection or trichomonas, which is sexually transmitted, or irritation from perfume products. So you have to be careful. We can diagnose this based on signs and symptoms. So we can get a swab and grow this bacteria out and confirm the diagnosis. Okay. One of the things that we do look at is looking for clue cells. Doctors typically diagnose this disease, and basically by taking a small sample of the vaginal fluid and looking for clue cells. And you can see the epithelial cell versus the clue cells, and under a microscope or by checking the pH, that will tell you really pretty well what's going on. And again, we can grow it out. Candida albicans yeast. This gets in through the mucous membranes. Discharge is white and curd-like, and it causes burning and itching and painful intercourse. Susceptibility is usually the women on antimicrobial drugs. It'll wipe out that normal flora because Candida is in the normal flora. But again, this overgrowth. You get an overgrowth of the Candida, and then you start to have problems. And immunocompromised patients can also have problems. You can treat with a antifungal drug, and the prevention is to avoid moisture in that area because that is a breeding ground for yeast. So when you look at it, this is what it looks like. You can see this little hyphae and those little yeast cells. I've got another picture of Candida for you in the other slides. And then you got to look at the sexually transmitted diseases. And we have bacterial, viral, and protozoal. So usually the young people who are experimenting with sex are at risk. Female adolescents, the younger females, are at risk because the cervical lining has not, let's just face it, it's because of they haven't had sex as long enough as the adults. And so that cervical lining is thinner and more prone to bacterial infection. It's a fact. So prevention is usually abstinence or mutual monogamy. Condoms must be used properly and consistently. But there are some factors that can set you up for this. Okay, so let's kind of look at these. First of all, pelvic inflammatory disease. Untreated PID can cause ectopic pregnancies. And in case you don't know what that is where the fertilized egg implants in the fallopian tube versus the uterus. And if it grows, that is a medical emergency, because as that fertilized egg grows, it can rupture, and that can be that is a medical emergency. It can also cause sterility. You can get so much infection in there that it is a problem. Cause is obviously Neisseria, gonorrhea, chlamydia, which is a major one, and then rarely mycoplasma. So the portal of entry is the mucous membranes of the vaginal area. You get inflammation, fever, abdominal pain. The incubation period can be pretty long for some of these, depending upon what it is. And the susceptibility is women with untreated gonorrhea or chlamydia infections. It can really get up into these other pelvic areas. There's several treatments, but you get an STD, and it can really get up into these areas and damage that whole fallopian tube area and just cause all kinds of problems. Bacterial STDs are common. The bacteria that cause the STDs survive poorly on inanimate objects and are just transmitted via sexual intercourse. Some of the examples: gonorrhea, syphilis, chlamydia, chancroid. I'm going to go through these. Gonorrhea caused by Neisseria gonorrhea. There's your diplococci, gram-negative diplococci. That is diagnostic for gonorrhea. In the males, it does cause a drip, pus-filled drip. Generally, the females are asymptomatic, which is why they can develop this PID, because the symptoms of gonorrhea are generally asymptomatic, and then it gets up into the rest of the reproductive system, and you've got all kinds of issues. Okay. Another one is syphilis, Treponema pallidum. You do have different stages. The primary syphilis is a hard canker. It's a hard, painless lesion. Secondary syphilis, you get a widespread rash, sore throat, and so on. Latent, kind of sits for a while, and then it may or may not go into tertiary. If it goes into tertiary, that's a major problem, and it will cause these gummas, which are these big sores, face and the rest of the body. It can cause dementia, blindness, paralysis. It's just, in tertiary syphilis, people go mad. I mean, there's been a history of, before we were able to treat syphilis, of plenty of famous people dying from syphilis, going mad from syphilis. Okay. This is what it looks like, spirochete, and we can diagnose it either by looking for the spirochetes, or there are just regular tests for it. But way back when, before we had those immunological tests for the syphilis, we would take the material and do a fluorescent stain, and these guys would just, they glow and they get picked up. So there's the primary, there's the secondary, and here's the gumma. They're pretty nasty. Chlamydia, this is a major problem now. Again, females, mostly asymptomatic. Males, painful urination, pussy discharge. There is a form of the disease characterized by these genital lesions and the swelling in the groin, lymphogranulum venereum, and you'll get these real swellings, and a bulba grows. Okay. You can see there's the affective form and the reproductive form of chlamydia. And what happens is there's the life cycle. The elementary body gets in, and within 6 to 12 hours, it becomes a reticulate body, and it replicates and replicates. And within 48 to 72 hours, it lyses the cell and starts to spread. Yeah, real nice. So it enters the body through abrasions or lacerations, and infects the cells. You can get it in mucous membranes, conjunctiva of the eye, chlamydia in adolescents is associated with an increased risk of cervical cancer. It is the most common reported STD in the U.S. So, FYI. Diagnosed by our, as I said, our biotech methods, chlamydial DNA, you take that DNA and you replicate it by PCR and you can do it. It is treatable with antimicrobial drugs, but it'd be nice to have it prevented. Chancroid, this is a little bit interesting. This, instead of painful cankers like syphilis, these are soft cankers or ulcers, particularly in the male. For the female, it's pain on urination because they've got these cankers inside, caused by Haemophilus ducreyi. It does produce a toxin. It is rare in Europe and North America. It is endemic in the Caribbean. So if you ever go to the Caribbean islands, you'll be offered all kinds of services. Don't avail yourself of those services, FYI. It is treated with an antimicrobial drug, but these sores can get pretty big and they can get pretty nasty. Virally transmitted STDs, genital herpes and genital warts. So herpes, small blisters on and around the genitals or the rectum. Herpes simplex 2 is the main cause. It can be in with type 1. The virus can become latent in the nerve cells. And what it does is it kills these epithelial cells at the infection site, and blisters may form at sites far removed from where you got it. So if you get herpes, it quadruples the risk of an HIV infection because you have open sores. All right. Diagnosis is on the lesions. You can treat with acyclovir or other antivirals. Prevention can be achieved, but condoms often provide little protection because these lesions are elsewhere. Okay, so you can see these. It spreads into the nerves, and you can see the site of latency, and it can sit in these nerves for quite a while. Human papillomavirus, HPV, causes genital warts, flat lesions, small cauliflower-like bumps, or little projections. In the women, the warts usually are on the vulva, but can also occur near the anus or the cervix, or in the vaginal area. In the men, generally the warts appear on the penis and the scrotum. They rarely cause discomfort or pain. They may itch. Some strains, as we know, can cause cervical cancer. Not all the strains do. And those are the strains that cause cervical cancer are the ones that are put, and that can cause these cancers, are the ones that are put in the vaccine. Just FYI. Trichomonas. This little guy, this is the most commonly curable STD in women. It's a little, lovely little parasite. Females, foul-smelling, yellowish green discharge. And you heard me say that females usually asymptomatic. This is where we switch. In the men, they are typically asymptomatic, and it's the females that generally show the symptoms. Okay. Again, transmission via sexual intercourse. It is curable. Usually, it's individuals with multiple sex partners or infected with another venereal disease at a time is at higher risk. That's what it looks like, and we can actually see this sometimes if we get a urine specimen that is contaminated with a vaginal discharge, which is not unusual. We can actually see these guys swim. Okay. So that's it. We're done, guys. So take a look at what I've sent you, and take a look at the labs now, and that'll be what you need. But I'll have the notes as usual on what you need to know for the test. Okay.